Hello, good morning everyone. Today I will be sharing information on cost effectiveness of transitioning from iron folic acid to multiple micronutrient supplements, referred to here as IFA and MMS respectively. For the outline, I will be presenting what the context is, followed by the evidence on effectiveness and cost benefit, then an introduction on the MMS cost-benefit tool and the result of the analysis done in the Philippines. Before I proceed, allow me to give a brief overview of who we are, what we are doing globally, and here in the Philippines. Nutrition International, formerly Micronutrient Initiative, is a global organization dedicated to delivering proven nutrition intervention to those who need them most. That is, the adolescent girls, pregnant women, and young children. The organization is supported by the Government of Canada and works in partnership with countries, donors, and implementers to conduct cutting-edge nutrition research, support critical policy formulation, and integrate nutrition into the broader development programs. Our vision, mission, and purpose is to improve nutrition of the most vulnerable groups through low-cost, high-impact intervention to increase coverage, partnering and leveraging with government and partners, and influence policy environment. To date, Nutrition International has offices in 10 countries in Africa and Asia and maintains the provision of vitamin A supplements in more than 60 countries, including the Philippines. Our core programs focus on maternal health and nutrition, birth package, micronutrient supplementation, food fortification, and IYCF. Nutrition International in the Philippines was established in 2016 to support the Department of Health and the National Nutrition Council to strengthen health system and nutrition programming. Our major projects include the Right Start initiative that focuses on maternal health and nutrition in the first 1,000 days. Under this project, we established a mother-to-mother support group composed of pregnant mothers and mothers with children under 2 years old, called Barangay First 1,000 Days or BF1KD. It is now operating in 800 barangays in Antique, Iloilo, Bohol, and Cebu. On its extension phase, BF1KD is being scaled up by some LGU partners and planned to be adopted in non-project areas. Another project is the nutritional technical assistance. Under this mechanism, support is provided to NNC in the implementation of the Philippine Plan of Action for Nutrition and how to mobilize LGU to improve nutrition programming and investment. In partnership with Swilig Family Foundation is a project on developing a nutrition governance model in the first 1,000 days implemented in 3 cities, namely Palawan, Tagum, and Tacurong. On micronutrient supplementation, currently IFA supplementation is the intervention in the country to reduce the risk of low birth weight, maternal anemia, sepsis, and preterm birth. Following WHO guidelines, the supplements contain 60 milligrams iron and 400 micrograms folic acid. Supplementation is daily to be started as soon as pregnancy is detected or a total of 180 tablets. On MMS, what is commonly used in other countries follows the United Nations International Multiple Micronutrient Antenatal Preparation or UNIMAP, containing 15 nutrients where iron is 30 milligrams and folic acid is 400 micrograms. Why transition? We all know that anemia is a persistently high life-threatening deficiency among pregnant women in low and middle-income countries. And with plant-based diet, deficiency from other nutrients is expected to be high that would benefit from MMS. This slide briefly summarizes key findings from the most recent Cochrane systematic review comparing IFA and MMS by Kitts et al. In 2019 and Smith et al. In 2017. From both reviews, evidence is strong that MMS has additional health benefit for the baby over IFA, as you can see in the red boxes. That includes reduction of risk of babies being born too small, as indicated by low birth weight and small for gestational age, as well as preterm birth, and also potentially reduces the risk of stillbirth and neonatal mortality. The blue box states that IFA and MMS are equally effective in reducing the risk of anemia during pregnancy. Evidence also shows no increased harm to pregnant women or their infants from taking MMS daily throughout pregnancy. The 2016 WHO recommendation on ANC for positive pregnancy experience does not recommend MMS because of limited understanding on its effect and potential harm. To close this gap, Limestone Analytics and Nutrition International conducted a cost-effectiveness modeling study replacing IFA and MMS in the context of 3 high-burden countries in Asia, that is Bangladesh, Pakistan, and India. And the positive findings lead to other studies led by Engel and a meta-analysis by WHO. Finding leads to, to the development of the now MMS cost-benefit tool using effect sizes from the Cochrane and Lancet systematic review. The conclusion of MMS remaining very cost-effective in all scenarios and across all countries was used to support WHO guideline review process on transitioning to MMS, and in 2019, the recommendation. The full report can be downloaded in the link provided here. On cost-effectiveness study, the result of the modeling study done in India, Pakistan, and Bangladesh was published in the Journal of Nutrition in 2019, and it shows that MMS is very cost-effective compared to IFA, and in all scenarios would avert 2 to 3 times more disability-adjusted life years or DALY than IFA. In the context of Bangladesh and Burkina Faso, findings was published in the New York Academy Science special issue in May 2019 by Inglestone et al. The finding was the same, bringing into conclusion that MMS is cost-effective in saving more lives and reduce lifelong disabilities. The MMS cost-benefit tool is a translation tool that analyzes the value for money of transitioning to MMS from IFA. It has the analytical capacity to estimate the impact effectiveness of MMS compared to IFA and calculates the required cost and return of investment or cost-benefit ratio based on country's context. The tool is straightforward, user-friendly, easily accessible, and free online. The boxes below shows the analysis tab, where the first tab shows the assumptions, the second box shows the result of the effectiveness analysis and the translation to DALY, and then the value for money or cost effectiveness in the third box. On the assumption box, you can enter country-specific data on estimated population of pregnant women, time span over which users wants the benefit to accumulate, coverage, and cost. Costs include cost of prescribed 180 supplements and logistical as well as program cost. Cost of the supplement is based on the 2018 UNICEF supply catalog. And given this data, the tool shows the result of on effectiveness aggregated to DALY and then the cost benefit. Whether to decide transitioning is cost effective or not is based on the WHO guidelines on threshold. Using the result, government can be clarified by key questions. For example, given IFA coverage, is it still effective to use MMS? Another question is if government will produce and procure MMS locally, is it still cost effective? How about the case in the Philippines? The result of the analysis using the tool is presented in a policy paper answering the question, is transitioning from IFA to MMS a better value for money? The link of the paper is shown below. Based on the analysis done in 2019 using Smith et al. Effect sizes, transitioning to MMS to IFA will avert an additional $590,000 and 5,162 child death valued at $5.3 billion in 10 years through averting cases of stillbirth, neonatal mortality, babies delivered premature, and small for gestational age as shown in the analysis tab. This translates to an additional $11.3 million or $19 per DALI averted. Comparing benefit with cost, the benefits outweighs costs at 463 times to 1. On the question whether MMS is better value for money than IFA in the Philippines, the answer based on WHO threshold is yes, it is very cost effective. The tool is dynamic. The next slide will show the result when data on cost was updated given the currency change. The updated result using Kitts et al. Estimate on effectiveness, which is a conservative estimate, and the currency update as of March 2021 show benefit was reduced to 363, but still very cost effective. Based on the findings, there is strong evidence that transitioning leads to significant perinatal health outcomes, and it is cost-effective based on WHO guidelines with high return of investment. I will end my presentation with the following question to ponder on whether or not transition to MMS from IFA is cost-effective. Important to consider is the landscape we are operating on. Do we have supportive leaders? Do we have the budget? What are the lessons we learn from IFA supplementation that we can use in MMS to improve compliance? To learn more about the MMS cost-benefit tool and relevant materials as well as policy brief of each country, the link is shown here. It is also featured in the Sight and Life special report. Before I leave, allow me to thank our technical advisor in Ottawa, Canada, for sharing the slide presentation and their guidelines. Likewise, the Vitamin A Angels for inviting Nutrition International to this event. With that, I will close this presentation. Thank you for your time and kind attention.